Hello, this FERNE educational video discusses the treatment of emergency department patients with dizziness and vertigo in an attempt to successfully diagnose serious central etiologies. We're going to talk in this video about the difference between ATTEST and the HINTS Plus exam. My name is Ed Sloan with FERNE, ferne.org. More information on FERNE to follow. So what is the difference between ATTEST and the HINTS Plus exam? A test is a process. A test looks at associated symptoms, timing and triggers, examination signs, and confirmatory testing. So a test addresses a method for determining the history, physical exam, and diagnostic tests that help to determine whether the acute vestibular syndrome is related to a central etiology. The HINTS Plus exam, on the other hand, is a physical exam test. The HINTS Plus looks at head impulse, nystagmus, test of skew, truncal ataxia and gait, and anterior stroke signs. So, if you have no unilateral saccade on HIT, that means that there's no peripheral vestibular syndrome or system problem. If you have bilateral fast, vertical, or rotational nystagmus, especially when unprovoked, that is central etiology nystagmus. If you have a vertical skew where the eyes or pupils are not aligned on the vertical axis, that would be a central etiology. Truncal ataxia and ataxic gait both suggest central etiology. And if you have any anterior stroke signs, of course, this would suggest a central etiology. If any of these five demonstrate a central etiology, then you must red light the evaluation, consider a central etiology, and hospital admission for this patient. So the difference between ATTEST and HINTS. ATTEST is simply a system that reminds us to assess the timing and triggers in an attempt to determine whether it is acute vestibular syndrome, where the dizziness and vertigo is constant and present at the time of evaluation, or episodic vestibular syndrome, either triggered or spontaneous. More of that information comes from the monograph by Jonathan Edlow, MD. And the HINTS method is the best method to diagnose central vertigo causes, and believe it or not, it is deemed and has been demonstrated to be more sensitive at determining a central etiology than our CT and MRI DWI testing. Again, my name's Ed Sloan. I'm FERNE President and Board Chair. I have no financial conflicts. Please go to our ferne.org website and our YouTube channel for more content related to the optimal care of the patient with dizziness and vertigo, and follow us on social media for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies, ferne.org. If you have any comments or questions, please go to ferne.org@gmail.com and send us any questions you might have. Thank you for your time and have a good day.